Jontes, Karibu, Alfred, nice to see you, the poet. Hi guys. 4 more minutes, we'll get going. Hey, hi. Nice to see you. Okay. They say surgeons are very impatient, but their 5 minutes might be 3 minutes. So I'm trying to stick to time. Welcome everyone. Join in, the more the merrier. It's the month of November. I'd like to introduce myself, but then also to just welcome everyone who's just coming in. Welcome. Pato, nice to have you. Fanny, nice to have you all. I said 5 minutes, so I'm still giving people 2 more minutes to join in, get to join in. I still don't know how to see the message part, but I will get to learn pole pole. Yeah, I will get to learn slowly. Terry, hi. So you can share this live so that we have more people. Even as we start. Thank you for joining. This is me trying out new things, using what I have, what we do every single day. So welcome all and thank you for joining me. I hope I am audible. It's nice to be here. It's November 2nd. I like just encouraging everyone. I know it's evening for some people. I would like to, hi Terry, just encourage everyone with a quote for today. The quote is, are your dreams shattered? The beauty of a dream is you can always go back and dream again. So please, let's dream big audacious goals. Don't live a life where you're not happy. So a quote we were reading today in the a few hours ago was, don't live through life as if the purpose of living through life is to go and get safely at the gate of end of life. Yeah, live a really good life. It says swipe right to view messages. I don't know. Yeah, so don't live a life where you're just living, life is just passing you by. Do something with what you have, the ability that you have, and I'm trying to do what I think I'm capable of. So it's nice to be here. It's nice to use what I am able to use, and I think I'll start by introducing my name. My name is Dr. Liz. It's nice to see you guys. I'm a general surgeon by profession, but I always say I like impacting lives through surgery and education. So I love educating people about their surgical health, surgical advocacy, and then just your the things you need to know from a surgical perspective. So I'm a surgeon. I live in Bomet and I run a school as well. I on the side, what I love, I love doing this. This is something new that I'm doing. It's my second day of doing this, but I think this year has been great because it's gotten me out of my comfort zone, and getting out of the comfort zone has meant stepping out and doing things differently. I started the year by attending like a training on how to create a vision board. If you want to know how to create a vision board, let me know, write for me a message, and we can do that even as the month and the year is coming to an end. And part of the getting out of the comfort zone in writing the vision board, which is right here, was getting out of my comfort zone. So this is me trying to step out of my comfort zone over here and daring to do my dreams, okay, and finding joy in what I am doing. So I'm really wanting to enjoy this space with you. Within the last 10 months, I have been talking about what I do, which is mentorship, coaching, career guidance, and clarity. But part of that is also educating the community on things surgical, medical, stepping out of your comfort zone, finding opportunities to do what God has given you. So last month we covered breast cancer, and I did a whole month of just interviewing people, having discussions about what it means to be an advocate of breast cancer. We will not stop just because the month has stopped. It is good to know that 7,000 to 8,000 Kenyans are diagnosed with breast cancer every single year, and 1 out of every 2 of those end up succumbing. So the push is for you to get early diagnosis, get your screening early. Go for a mammogram if you're above 40 years at least once a year, or a breast ultrasound if you're less. Learn how to do a self-breast exam. I did that. You can go through my page and look at it. When to do it, how to do it, the things to watch out for, if there's any abnormality in the shapes of the breast, if one looks like it is attached to the chest wall, if there's any abnormal discharge, if there's any growth that you're seeing that is not normal, and then also if there's any growths or lumps at the armpit, the axillary region. And if you have any questions, please feel free to ask me. And then yesterday we went through some of the false assumptions or the false myths about breast cancer. What is being said that is not true. So I'll briefly go through what was said. One, you can I've put a pin. You can really message me directly. There's a pin from there. You can send me a direct message right now. But one, breast cancer affects both male and female. Dr. Temple, it's nice to see you. Yeah, so men can get breast cancer. 1% of the breast cancers are found in men. So as part of November Breast Month, Men's Health Month or Men's Wellness Month, you can also get breast cancer. 2, wearing a bra does not increase your chances. So remove that one. Women, wear your bras. Any sort of bra, whether it's strapless, whether it's clear, whether it's the ones that you just strap on yourself. Bras do not give you breast cancer. Implants do not give you breast cancer. You should live a healthy lifestyle, do your exercise, eat healthy, well-balanced diets. That reduces your chances of converting fat cells into estrogen. So reduce your alcohol intake, avoid cigarette smoking, avoid anything carcinogenic. It reduces your chances of getting cancer. And then the other things, if you know you have a family history of breast cancer, if someone in your family, an immediate family member, that is either a direct grandmother, a direct mother, a sister, then come and we can do clinical breast exams and we can see if you're at high risk. Then we can send you out and get you can get those mutation studies tested, but that is really a bit high and intense. But I don't want to dwell a lot on that. I will share the recording that we did yesterday. Today, I want us to also think of the men, equally. We say, let us be equal. Let us think of the men and the women because we live next to each other. God created women after men. but this is November month. This is a month to just I'll say breast. There's breast, which we've handled. If you have any questions or if you want me to tackle anything on breast issues, let me know. Women and the breast. And then for men, I think prostate. November is known as the men's health and wellness month. So we want to prioritize the man in these discussions. So I want to invite you. Let us talk about men's health. Let us focus. It's a dicey subject because men do not like talking about their physical health or even mental health. It's very hard to have these discussions, but I'm inviting us to try and have those discussions. They're important discussions. So the purpose of this session is just dedicated to raising awareness about, yes, there's a breast and the wellness for women, but also let's focus around men's health and their wellness. I have a phone. I'm going through the things that I have written. So what is men's health and what is men's wellness? Yeah. How can you define men's health? What is a man's health? Are we just naturally healthy? Because healthy, there's a preventive part of you taking care of yourself. So preventive aspect. How do you take care of yourself? What are the things that you do so that you live a long and a really good life out here? How do you take care of yourself even when you get disease? How do you improve your chances of increase your chances of survival? The way we've talked about breast cancer, and how with breast cancer, if you do get to learn how to do a self-breast exam, get your clinical breast exams, and get your screening, it increases your chances of survival and you get proper treatment. So men's health refers to the physical, mental, and emotional health of men. Yeah. Physical, mental, and the emotional aspect of health of men. It includes preventive measures. We've talked about that, the things to prevent, right? Are you living a good life? Is it a good lifestyle? Are you avoiding certain foods? Yes, they can affect your sexual health or how you perform. Yeah. How are you taking care of yourself? Sexually transmitted infections. If you don't take care of yourself, if you get frequent sexually transmitted infections, they will affect the tract, that pipe where the urine passes, and it can get blocked. So what are the things that we are doing that can be harmful to ourselves? And then, so it involves preventive measures. It involves health education, like what we're doing right now. Welcome, Amos Mukanda. It's good to see you. Let me invite someone. Yeah, it's good to see you all. Gilbert Lele, it's nice to have you. Amos, karibu. So we are going to have health educations. We're going to create awareness and also getting treatment early. If you see abnormal discharge in the urethra, you should get treated. Don't treat it. Don't just let it pass, because men, your sexually transmitted infection can be transmitted to the woman and vice versa. So you both treat your partner well and treat yourself well, so that you live a long life without any complications that might, just affect your men's health later on in life. Yeah. Are you using protective what do we call them? Are you protecting yourself when you're having sexual intercourse, so that you don't get any STI? What else? We can learn about the main organ in the male anatomy, the prostate. And we only learn about prostate because we think prostate is for old age. It tends to occur on the older ages. But what is normal enlargement of the prostate that comes with age, which we call benign prostatic enlargement, versus what is prostate cancer? Other things that we talk about: hernia. Hernia is this abnormal protrusion of like the intestines when they go down, and you have this swelling that goes to the scrotum, and sometimes it looks big. So it can either be fluid, it's called a hydrocele, or it can be a hernia, which is just a protrusion that goes because of a defect on your wall of the abdomen, the inner portion, the intestines that are within the abdomen, or the contents within our abdomen, it tends to pass in a shuka chini, and it goes to the scrotum. And if you don't take care, for some it can cause pain and it can be blocked, and if it is blocked, you need to go urgently to theater. Then you also have hydrocele, like elephantiasis of the scrotum. So those are things that we don't talk about until we get to a point where we need to talk about. There's twisting of the testicle, what we call testicular torsion. Are we ready to have those conversations, men? I know they're women. It's also good for a woman to know. Nancy, thank you for joining. Hi. Apostle Bernard, are we ready to have those discussions? John Kagushia, the men in the room, are we really ready to have these discussions? Let's have these discussions. They are real discussions. They are problems that help, that affect us sometimes. And then there's men's mental health. Yeah, there are things that are surrounding us that are affecting us psychologically. There are things that are external that might be affecting our physical ability. There's sexual dysfunction. There's erectile dysfunction. The inability to perform. There are drugs that people end up using or do not know how to use, and they Google, are they safe? What do you need to consider before you start taking some of these drugs, right? So those are a couple of things that we can handle. So what it will encompass, what will it entail when we talk about men's mental and physical and emotional health and wellness? What are the general wellness practices? What should you do? What are the preventive screenings that we need to? If you're a man and you are at least above 45 to 50 and going above, every single year you should at least get up a PSA test, a prostatic specific antigen test, to check whether it is normal or abnormal. So that is the annual screening test that we do for men, a PSA that is checked, but also you need an exam by the doctor depending on that test, yeah? And if you're having any difficulties in passing urine, whether you're pushing a lot, you feel like you're pushing a lot, or you feel like whenever you go to pass urine, sometimes you feel like yote haijatoka, there's still some that is remaining, you need to check on those. Whether when the urine is flowing, is the flow normal? You know your normal flow and the stream and where it goes. If you feel like it's cutting down, some of it can happen with age, or instead of the normal flow, it plays out as if that pipe has been blocked. You need to get it checked. Is there an abnormal discharge? Yeah, there is a normal discharge that might come, with any morning. If you have a morning wet dream, or you're having the ejaculatory fluid, but that is normal. What is abnormal for you, and what do you need to check? Is it green? Is it foul smelling? Does it look like pus? How is your partner? Is she complaining about a discharge? Hi, Frida. Is it an abnormal discharge that you're both seeing? Is there itchiness? And then you look at the anatomy of your testicles. How are they? Is it swollen? Is it normal? So it's good to know how things are down there and to check yourself. So that's part of general wellness and the practices and the things you're examining and checking out. The same way we were asking women to take some time and look at their breasts. Start by just looking and seeing how it is moving, both when you're at the front and when you're on the side. The same thing for a man. Regularly just check and ensure everything is okay. Are the testicles okay? Does it look like something has, when you stand or when you're lifting something heavy, there's something that comes down, and when you lie down you're able to reduce it? Or has it gotten to a point where you're not able to reduce whatever fluid that is coming down back into the abdomen? Then what are some of the nutritional things that you need to know as a man to take care of your male men health? What are the nutritional aspects that you need to consider? Exercise and its role in men's health. Hi, Rita. Chetty Flo, welcome. Mental health, yeah. There's a lot of stigma around mental health and how the male or the men can have a mental health seeking behavior. How do we encourage men to seek help? It's okay not to be okay. It's okay to tell yourself, I am not okay and I need help and I need to go and get evaluated. A wise person seeks help. There's a lot of people taking their lives and it should not go that way. So it's okay to embrace that the world right now, we're going through a lot and we all need to check our mental health and wellness, yeah, to handle the things that affect us. So that's part of mental health awareness. How do we break the stigma around mental health? How do we discuss the different coping strategies that are there, Jared? How do we address what are the barriers that prevent men from seeking mental health assistance? What is mental health and how do you prevent yourself? How do you see a psychotherapist? When do you know everything is not okay? How do you set up a supportive system for the men? And how do you protect our children as well? And then the gynecology for men, yeah? And that we're discussing the unique health issues that men face, yeah? Including where I don't think men are taught how to just support your partners, yeah, in health and wellness. Yes, you might have a spouse who's going through pregnancy, but what are the fears that you go through at that period? You have a family, you know, a child comes with a lot of, responsibilities. How does a man talk about that? I'm your Darren, welcome. Bubbles, it's nice to see you. How do men have a supportive system? How do I reach out to another man? And whether I'm able to see them or not see them virtually or in confidence, how do I talk about the fears that I have and the anxiety that I have in raising a family and starting out with a child? How do I take care of the child? How do I handle the baby? What are the things as a man that I should know? What am I expecting when the woman goes into labor? So those are the things I think we should just try. I'm just highlighting them. And if you're able to reach out, please kindly reach out and let me know what part of this that you think is really important and we should handle fast. So that's the gynecology for men. And then there's also the aspect where men and family, I hadn't written it down, but I think it's very important. How, so the baby comes, and then now the woman focuses on the baby. How do we learn to work with our spouses so that we are not left behind? So there are responsibilities in the family, in the home. There are responsibilities, other responsibilities that come with your workplace. There are responsibilities of your in-laws and your immediate family. Our parents are aging. There are responsibilities of thinking about education for this child or children. And then there's insurances that you have to take to protect your children and also to take care of your parents who might be at the point where they need to constantly go to the hospital. How do we set up such support systems? Are there insurances that we all know that we can help each other? Let this be a place where we can have those discussions and we can have groups that develop that support the men. And remember, it's about supporting men to be strong and also to be vulnerable enough to say, I am not okay and I need help, because we as mothers also have sons, we have brothers, we have fathers, and they're struggling sometimes and they can't. Premium, hi, premium to us. Yeah, we have siblings and it's hard to watch them struggle. How to create a supportive system for the man so that they can be able to talk and still feel like they're man enough. Yeah. Nutrition and exercise. How does diet and fitness play a critical role in overall health and longevity of the man? Yeah, how should we view health and fitness for a man? Keep coach terer. What are the things that we should be eating more of? What are the different stages of our lives where at a particular stage, we are robust, we can do the exercise. As we grow older, what are some of the exercises and nutritional aspects that we should put into our lives? Yes, and as we grow older, there are illnesses that come just because of age or sedentary lifestyle, diabetes, hypertension. How do we take care of ourselves? Some of these things just come. And then there's the aspect, I put it in quotes, there's the aspect of libido. Yeah, that's a topic if people want to talk about, we can also talk about how do you handle libido and how does libido change with age. So I need some men to come out and have these conversations with us. This is a breakdown of what we intend to cover. Yeah. And then what are the preventive screenings that you need to do as a man? The importance of routine checkups and what tests men should consider. So one, as you grow older, the things that I think you should consider, even as we are listing these things down, beyond 40, 45, start checking your blood sugar. So do fasting blood sugar. Look for a time within the year if you're able to have an insurance and go to a hospital and get some tests so that those ones can be your annual checkups that you do. So when you go for an annual checkup, you can either do this at the end of the year, or I highly encourage either at the end of the year or at the beginning of the year. The beginning of the year can be more harder just because we have a lot of responsibilities. So maybe at the end of the year, probably around December, or now for the men, this is the November month, men's month. This is the time you should probably get your annual screen. And your annual screen should include, one, when you go to the doctor, they check your blood pressure when you're sitting or standing and just ensure that you have a normal blood pressure. They check your heart rate. They should check your oxygen level. If you're talking, you're moving, and everything is okay, should be okay. Yeah. The main things that from a blood perspective you should have checked is a fasting blood sugar if you've not taken breakfast, and a random blood sugar, and compare it with what is normal for the lab in that health institution. So check your blood sugar, and the blood sugar can either be high that's a hard name. Kerry, Raf, welcome. Kipkoech, Nyadhi, Karibu. So check your blood sugar. And the blood sugar, if you've not taken anything in the morning, that will be called a fasting blood sugar. If you had eaten, that will be a random blood sugars. They are reference ranges to ensure whether they are normal. If they are abnormal, there'll be an extra test that will be asked for. The glycated hemoglobin in the sugar, HbA1c. Mona, welcome. They will check for that. And then I think it's also important to check your cholesterol level. Cholesterol level will be the cholesterol, and the lipid. So they call them lipid profile tests. Those are important. If you can write this, you can go and have them checked if you love yourself, men and women. These are also good tests for women. Get your blood pressure checked. Ensure it is normal. Get your heart rate checked. Just know what your oxygen level is. It changes with time and how you're seated, whether you're standing, whether you've done anything aggressive. Get a sugar check done. So it can either be fasting blood sugar or random blood sugar. Then check if it is abnormal. There'll be a hemoglobin, glycated hemoglobin, HbA1c, that will also be checked. And then lipid profile. That checks the cholesterol in your body, ensure it is within normal reference. Other things that I think are important is check your kidney function, and it can be as simple as a basic creatinine test to ensure it is normal. For men, if the prostate becomes big, the prostate is an organ, it's this size, or smaller. I think it's actually much smaller than this, probably the size of this. But as you grow older, it's a gland that produces testosterone. It's involved in the production of testosterone. So it's a gland that is within the male body. So when the testosterone level is low, as you grow older, it tends to work harder, yeah, to produce more testosterone. And as it tends to work harder to produce more testosterone, it enlarges. And so you might find that you have normal, because it's age-related, enlargement of the prostate. In between the prostate, there's a pipe, and that's a pipe that drains the urine. So above the prostate, the bladder sits. And then the bladder is connected to the outer part by a urethra, which is a pipe that passes down the prostate. So if it enlarges outwards but also inwards, and it causes a blockage in the urine passage. So for most people, they might have difficulty in pushing the urine out. If it's completely blocked, then it might cause it might cause a closure in the urine passage, and that might make your kidneys get a backflow, and the creatinine might be high. I'm trying to make this as easy or as simple. So a creatinine will be very important. And then for men, the PSA test, prostate specific antigen test, is important. So we've talked about a couple of tests that you should be doing. Some of the screening tests, we'll go through them again at some point. So those are the routine checkups that you should get checked. And within the routine checkup, also for the men, for women, when you're doing routine checkups or you're doing an annual checkup, it's good to get a vaginal examination and a cervical pap smear, which we can talk about. We're going to December and then January, because cervical cancer is also a common cancer, but it's associated with poor survival just because the diagnosis is very late. So as we're getting to the end of the year, let's push more women to do self-breast exams. Let's push ourselves to do more self-breast exams. And if you're not able to, let me know. If you're able to, or if you have a clinician, they can go and teach you how to do a clinical breast exam. Welcome, Cheryl. And then with assistance, you can also get screening. So for women, if you're above 40, get a mammogram done annually. If you're less than 40, get a breast ultrasound. For men, annually get a PSA, and also the doctor can examine the prostate. If it is large or the PSA is abnormal, then they'll have to do a prostate exam to determine whether you need a biopsy of that prostate gland. I know we have fathers, and even when we have fathers, ladies, sometimes they don't want to talk about these issues, so they just want to go to the daktari. And they really keep quiet until when things are really, really bad and they're completely blocked. So if you're able to support a father or an older brother, have them go and see a urologist or a doctor and have them get the PSA checked, assessed, and maybe get a rectal exam and have a review of the prostate gland. Lily, nice to see you. So other things that we will cover, right? Stress management. What are the techniques for managing stress? Yeah, including mindfulness, creating some me time, men, being mindful, and creating some time to charge or recharge yourself. That is very important. Yes, there's a lot of responsibilities, but imagine there's no life without you, and you have this one life, and you need to take care of yourself. Yeah, you need to take care of your health. There's a lot you have to do in this world, and I think it starts by one starting to protect yourself. So stress management techniques. We explore techniques for managing stress, including mindfulness, physical activity for the man. What are the important physical activities? Yes, sex is a physical activity, but beyond that, other than the sexual activity, what are other activities that you can get and do that will help you? Yeah, reducing your alcohol intake, reducing the smoking. What are other things that you can get engrossed in? What I hope you will get out of these sessions or these talks, what do I hope you will get? One, that you will get empowered as a man or as a woman who has a man in their life. yeah, with knowledge, awareness, and tools that help you to make informed decisions about your health or about your man's health if you can assist him. Yeah, make good informed decisions about your physical health, your mental health, and your social health as well. Social is important. For men, sometimes the people we surround ourselves with can make us and they can break us. So it's important to realize sometimes when to let go, or just have a call yourself to a meeting and know that socially you need to surround yourself with people who build you, not people who push you into depression. Awareness. I hope that out of these sessions you will get awareness and understand the importance of routine health screening and proactive health. Yeah. Faith, karibu. So you need to take care of yourself mentally. You need to take care of yourself physically. You need to go for screening. Ladies, get a mammogram. We've just finished. Yeah, we've just finished our month. I mean, it ends over there. We need to also, if you never got an ultrasound, or if you never got a mammogram, if you're above 40, doesn't end with October and you say I'll wait for next year. November is still a month, it's another day. Please ensure that you get screened. Please ensure that you're purposing to do a self-breast exam, because it might help you diagnose a cancer early. For men, this is your month. Please ensure that you are coming every single day so that we can learn about men's physical health, mental health. Get your PSA checked if you're above 40, 45. Get to know whether within the family is there a history of prostate cancer. Are you exposed? Are you at risk? Because it can also be familial. Get to learn about your anatomy, how things are. Is it normal? Are things, moving down to the scrotum? Look at the scrotum, ensure they are normal. Ensure there is no discharge. Are you taking care of your sexual health? If you have multiple partners, are you using protective gears? If there's abnormal discharge when you go to the hospital, please take care of your partner as well, because it takes two to tango or more. Take care of them. So I hope that you get awareness, empowerment, and I hope we can create a community, especially for the men and women supporting. We say he for she. There should be a lot of women that are also supporting the boy child and the men. A supportive space to discuss challenges that men face, even as we rear sons, and share experiences that are related to men's health. Yeah. Resources. I can share resources to further information and guidance for health-related topics. Susan Mwangi, thank you for joining. So I encourage all of us to just, maybe if you're able and wanting to join in as a group, share what you'd want to be addressed. We've said we can handle everything from the, men's health, from the urine, and if there are any urine symptoms, if you're experiencing any pain when you're passing urine, if your urine it doesn't look clear, what the color of the urine tells you as a man, whether you should hydrate or whether it is turbid, and whether you need to get that tested by a simple urinalysis, which can be as less as 100 bob. And what sexually transmitted infections can do. They can really mess up the tract where the urine passes, and you can get a stricture. And when the doctor says a urethral stricture, what that means, and if you don't treat it early, it can really mess you up. You might need to get a different pathway. What benign prostate enlargement means, and what prostate cancer means, and how you can get screened as a man. What hydrocele is, and how different a hydrocele is from hernias, and those are treatable surgically, versus what sometimes you can get inflammation. The sexually transmitted infection, if they get into the urinary system, they can give you a swelling of the testicles, which can really swell. So it's important for us to ensure that the testicle on itself has not twisted and closed blood supply, versus one that is more swollen and the epididymis and the testicle are they are infected and inflamed, which we call epididymochitis, which is a swelling which can go with elevation, ice pack, and antibiotics. All those are important, and what it means to be to seek preventively seek mental health and wellness, and how we can create supportive systems, and what are the barriers or the challenges you feel or you have to go through as a man, raising men, raising a family, taking care of your parents, learning how to walk this path, a man in this day and age. Yeah. And some of the tests that women and men we need to do as we grow older, the important annual screening test. And I'm pushing for people to do this as early as now, because come December we're in Christmas season, and then January we want to take children back to school. So that is my hope, that we will be able to cover all those. Let's spread the word about men's health and wellness, because November is the men's health and wellness month. Yeah, invite a friend to join so we can have engaging and an informative discussion. I want to just probably go briefly through women, and how women, we really need to learn how to do self-breast exam. Jackie, welcome. Know how to do your self-breast exam. Teach your children how to do self-breast exam as they grow older. When to do it, you do it a week to 10 days after your menses, in a quiet room, in front of the mirror. You've exposed yourself all the way till midpoint. You're able to look at both breasts. God gave us two, just like the testicles. God gave us two. Unfortunately for some men, that one, if there's a missing testicle, we can handle that. Yeah, the absence of the testicle, or if it keeps on going up and down. So for the women, you're looking at the shape of your breast. Are they equal? Are they symmetrical? Yeah, symmetrical is, do they look similar? Yeah, like we can say my hands are symmetrical. They have the same shape. Their fore and the thumb, they almost look similar. Maybe one is bigger than the other, but it's very slight. So for the breasts, are they same in shape? Are they rounded? Are they pendulous? Or does one look like it has a different shape because it's being pulled to one side? Are they similar? Then there's a portion, the nipple areola region. Your nipples, are they everted? They're not supposed to be inwards, inverted. That areola region, that skin, although it is darker than the other skin, is there any changes you note? Whether it's a wound, whether it's flaking of the skin, whether it's itchy, whether it looks like it's cut. Those are things to just monitor. And then, are there abnormal skin changes even on the other breast? Does it look like an orange peel, pure orange? Does it look like there's dimpling on the skin? Subtle, but you can see some dimples that were not there, and it looks thicker than normal. The other thing is to look, so you've looked to movement. Now you make motions, hands akimbo, raise them outwards, lift them up slowly. And you're looking to see whether the breast is moving on both sides equally as you're raising your hand and you're taking them down. And doing the same while you're on the side, you bend forward and you're seeing whether they are pendulous or they are not pendulous. Pendulous meaning they're able to dangle okay. If one is dangling freely and the other one looks like it's attached to the chest wall, that is a bad sign. Then after you've done that, now you need to palpate. Palpating means you are examining by feeling. So you use the second, third, and the fourth finger, and you're using this area. The right hand examines the left breast, and the left hand examines the right breast. While you're doing your examination, let's say the right on the left breast, this hand should be behind, and you should be lying down. And the motion you use, the breast is circular. You can use a circular motion. You go slowly round from outwards all the way to the nipple areola region, or you can go inwards in a circular clockwise motion to the outer end. And the breast does not end until you do an examination on the under armpit. You're looking for abnormal lumps. If they're there, are they painful? Is it movable or not? So not all growths are cancerous. If you see a growth, it should not tell you that it's cancer. It just needs to be examined and studied. Younger breasts will have mobile to growths. We call those adenomas, and those ones are not cancerous. You can live with them. But if their sizes are bigger, they should be removed. Examine this side, examine the other side, and then express or press on the nipple to ensure that there is no nipple discharge. Abnormal nipple discharge is not normal. So I think today I have covered men's. I've introduced men's health and wellness and what we entail to cover. Preventive, physical, and mental aspects of men's health and wellness. And it can be from many things, from the prostate to the scrotum to, younger children and how some are born and the glands has not been, you're not able to reduce the foreskin, and how important, especially for circumcision. I should mention this because it's the month where people get circumcised in November and December. Important to get a proper urologist or surgeon who will do a circumcision for your children. Ensure that your child does not have a bleeding disorder. Some of them have a bleeding disorder, and when you go to have a circumcision done, they bleed a lot. Those ones, if they need to have circumcision, should be done in a hospital setup. So circumcision should be done by a qualified surgeon or urologist. And then the proper care of a young man after circumcision. The importance of circumcision, it reduces the risk of penile cancer, because penile cancer is also a thing. If you see any ulcers on the penis, that's abnormal, you need to have it checked. Penile cancer, the highest risk is just multiple sexual partners, so you need to take care of that, of yourself, right? And then there's also the human papilloma virus, which is also sexually transmitted, so how to prevent that. Have safe sex, protect yourself, reduce the partners. Anything else, erectile dysfunction, that's a big topic, so we will also handle that on another time. So I'm looking forward to having this discussion, to having candid, really candid discussion with the men and the women. If you have anything, just directly DM me. If you have any concerns or if you want any topic addressed aggressively, please do not hide. It's okay to have these discussions. I think it's okay to be open about our health, both men and women. It's okay to support each other because we all need each other. So men, this is your month. Women, let's support the men, the poet. Let's support you, because we will also have sons. We also have brothers. We also have fathers. Let us not, especially men, listen to me. Do not leave your fathers. They don't talk about benign prostatic enlargement, and there's no way to know whether it is normal enlargement or cancer without seeing a doctor, and without the doctor doing a PSA test, a simple blood test called PSA, and doing a digital rectal exam to examine that prostate, and if they need a biopsy after that. So our fathers and the older men are suffering in silence until kinaumana wakati kumeblock, na ikiblock sasa anahitaji an external drainage, so he goes to hospital and anaekewa mpira huku juu. Yeah, you need proper advice. So before it gets to that, benign prostate enlargement, if they use drugs, they can live a long life just on medication, just like hypertension, and they live a long life. If you need surgery, there are different types of surgery. If it's prostate cancer, if it is also diagnosed early, they can get treatment. It's one of the best cancers and most forgiving because you can live a long life. But akiacha ikae sana, then the cancer spreads like any other cancer, breast cancer or any other cancer. If you don't treat it early, it spreads. And if it spreads, then it can go to different places. Yeah, it can go to the bone, and then they get this bad bone pain, weaknesses. Oh, I'm sorry about that. Yeah, they can get weaknesses on themselves. What have I done? Yeah, so I think I've opened up an invite and I don't know what to do. Monica can help. So don't let the men suffer, especially our dads. Ama wanashindwa to walk because it can even go and spread and block the spine. Then they get inability to walk, or they're not able to control the flow of urine. It's such a painful way and a miserable way to live. So I think we should just have more of these discussions to create awareness to you. They will not come to their daughters. They will mainly go to either sons if they have, or go to fellow men who sometimes do not advise them well, or they tell them to take herbal medication. Then when they completely block or they have blood in urine is when they now come to see a doctor. And when they see the doctor and they don't see a surgeon or a urologist, then they get into problems again. If you don't treat it early, what happens? When there's blockage on the prostate and urine is not passing, it will get backed up. And when it gets backed up, it can lead to renal failure. Yeah. So early treatment, early diagnosis, screening as much as possible increases the survival chances. It helps rule out cancer early, and it helps in just allowing a man to age gracefully without problems. I think a lot of them you will not know because they are carrying these pipes now na feature kwa pocket. Yeah. So I encourage you to have this discussion with brothers, with your siblings, with sons, or even invite them for these discussions kindly. Hi, Eva. So let's have this discussion. It's also good to have some nurses join in and they can enlighten some few people on what to do. Beverly, hi. Kashma. So watch out, look at this space regularly. Let's have more discussion on men's mental health, physical health. Yeah, let's talk about the prostate. Let's talk about the just sometimes you can get things as hard as, just penile cancer. We can have hydrocele. We can get the scrotum can be enlarged. Let's have those discussions because this is your month. Men, this is your month. We need to really, really, really talk about men's health. Do not let our fathers suffer in silence. Do not let them suffer until the time when it is really, really, really bad and they don't have an option other than to just get a pipe as the last resort. Sexually transmitted infection, if not treated, can get you a blockage and you can be in the same situation. So take care of yourselves, men, and take care of your partner because it can harm you both. Let's have safe sexual practices to reduce our chances of getting strictures, men, to reduce our chances of us women getting pelvic inflammatory infections and increasing our chances of getting ectopic pregnancies. Eva, welcome. White Rose, hi. Faye, hi. Mark Duke, hi. Let's have these discussions. I know they are hard. Let's support each other. Let's support the men's health. Let's support ourselves in having this discussion. Circumcision month is here. What is safe circumcision? When is it the time to circumcise? What are the things you look for as the children are healing from circumcision? Yeah. What are the abnormal things that you should watch out for, right? If a young child or a boy aged between 18 to 24, or even mostly at that age and younger, come complaining of pain at the scrotum, what are the things that you should be watching for? Yeah. So I'm looking forward. Let's join again tomorrow evening. Let's have this discussion. Let's have open discussion. There's no hiding. Dr. Google, you don't need Dr. Google. Let's just have those discussion. Erectile dysfunction. How do we handle erectile dysfunction? How do you reduce your rate of getting erectile dysfunctions? What are the screening tests that we should be checking? Get a heart rate, get a blood pressure checked. Please do that now. Don't wait for December. Don't wait for January. Check your blood pressure. Check your heart rate. Check your blood sugar. Ensure it is within normal. Check a cholesterol level because that is important. Check a kidney function tests. Those are basic minimums, and check your thyroid function test and we can talk about that. Blessed, thank you for joining. Hi. So we will talk about those routine screenings for women. Learn how to do a self-breast exam. I have described it. I have showed you. We can do that again tomorrow. For men, learn to be normal with looking at the scrotum. Ensure the texture of the scrotum is okay. The sizes might vary depending on the weather and everything. Look at the penis, ensure it is okay, ensure there's no abnormal lesion. The discharges that come, you know what is normal and what is abnormal. If it is abnormal, get checked. And then we can talk about the silent symptoms for prostate enlargement, prostate cancer, and many other things. This has been great. Let's do this again tomorrow. Have a great, great Saturday, actually. Yeah, let's do it tomorrow evening. And remember, I will end with this. I will end with this manifesto. How do I go back? No, I don't want to end. I will end with the Lion Chasers manifesto because I shared that, yeah? I know we're all here and it's been a long day, but quit living your life as if the purpose of this life today is to arrive safely at death. Live your life well. I challenge you to live a really good life. Purpose to have a good life for yourself, yeah? Give yourself everything. Challenge yourself today to learn more, to do more with the same 24 hours that I have that you have. You can do a lot more. Run to the lion. Don't run away from the lion. And the lion here is the big tasks, the dreams that you have, the desires that you have. Set big, audacious goals. Set goals that when people look at, they say, hey, you need Jesus. You need Jesus because those goals are too big, man. Cabinho, hey, your dreams. Our dreams are valid and we can get them if we desire to do, if we chase, and we have a Lion Chasers manifesto. Set God-sized goals, pursue God-given passions, and go after a dream that is destined to fail without the intervention of God. Stop pointing out problems and start becoming part of the solutions. I have this, it's on my table. I always look at it. Stop repeating the past. Your past is a past, it's gone. Start creating the future. And the best time to start, whether it's business or changing yourself or pursuing your dream, is today. It's either many years ago or now, today. So wherever you are, if you have a dream, if you have a desire, please start thinking about it and doing today. Don't say, oh, I'm waiting for the right time to meet the right person. The time to meet the right person, if you don't purpose, is now, because there's never a right time. A right time is what you tell yourself and what you pursue. Face your fears. Face them boldly. Call them out. Call them for a meeting. Call them and get into the ring and face them and punch each and every one of them. Fight for your dreams. Blessed, fight for your dreams. Queen Cest, fight for your dreams. Cabinho, fight for them each and every single day. Grab opportunity by the men. The men is that part of the neck of the lion. Grab it and don't let go of those opportunities. Take every chance with the opportunities that come to you. And there are some opportunities that will either open their doors. Those ones are meant for you. If those opportunities, if you keep on trying and they don't open their doors, maybe that's not the right time. But if you keep on knocking those doors, some will open. Those ones are God ordained and destined for you. Live like today is the first day of your life and the last day of your life. Fight for your dreams, guys. Fight for each and every single piece of your dreams. What are they? Just fight for them. Do you have any passions, any desires? What is your goals and what are your purposes? Write them down and fight for each and every one of them. Burn sinful bridges. Blaze new trails. There are trails that you've gone through. Those are the past. Be a trailblazer wherever you are. Start trailblazing. And trailblazing is just as simple as just starting with what you have with wherever you are. I think I'm trailblazing in my life because I'm doing this. I never thought I would be able to do this. Yeah. And live for the applause of you did it and you did it well, and you have nail scarred hands because you went and you worked hard, and you can see it because your hands are sore, your body is sore, you worked hard for it, your eyes are sore. Don't let what's wrong with you stop you from what you're doing. You can always learn from failure. Yeah, we fall, we fail. I shared just today. Do you know that Thomas Edison failed 50,000 times? 50,000 times before he made the first battery of light. Yeah. There's a tire that is called Goodyear. There's a story of Charles Goodyear. I don't know if you people know. There's a Goodyear tire, like Yana tires. And Charles Goodyear is a story of the man who made that tire. And he discovered the Indian rubber. And he noted that the Indian rubber used to melt. But he wanted to make rubber tire that does not break down with heat and is durable. So he had that dream and he kept on working for it, and he kept on telling people, but people despised him. He lost his job, excuse me. He had to sell things so that he can keep on experimenting. When he had debts and he was put in prison, people still didn't believe, but when he got out of prison and he had to just pay the debts off, he worked on his experiments. And how many years did it take him for him to prove that Goodyear, the rubber tire, he had to vulcanize that rubber, and eventually he made the most durable rubber tire, Goodyear. So when you look at Goodyear, remember that it took him 10 years to come up with a solution of a rubber tire that does not wear out or does not, just is durable and is heat proof. Goodyear tires. When you look at electricity, think of Thomas Edison and the 50,000 times he had to fail. Yeah. We are where we are because of people who persevered. So are you willing to persevere? A story is told of a man who had what do you call it, a pond or an aquarium, and he had fish. He had this big fish and he had the small tiny fish, and he put them in the same fish tank or aquarium. It's called aquarium, a fish tank, but he separated the two by putting a glass in between. So anytime the big fish used to see the small fish, it would try and go through, but it can't go through because there's a glass. For 3 days, it kept on trying. This fish kept on trying. It kept on trying to hit that glass and go and eat those minions. But it discovered it was not able. And after that, it resulted to eating the fish food that it was given. So after 3 days, the owner of the aquarium took off the glass. And guess what happened? Those small fish just kept on swimming around, all around the big fish. And he never ever tried to attack them again, because in his mind, he thought, or because he had gotten these failures in going forward, that he would not be able to. So how many times are we like this big fish that tried for 3 consecutive days to eat this fish but was stopped by a glass? Yeah, is that you? What if he tried one more time? See, obstacles will always be there, challenges will always be there, but we have to persevere. We have to keep on persevering. Have to keep on persevering to pursue our dreams, to challenge ourselves, to chase the lions that we want to take up. Yeah. So don't be like that big fish. Yeah. Don't be like that big fish that gave up so quickly. Yeah. If you want to stand with the heroes or the people that we've talked about, the Goodyear, think of the 10 years he had to keep on persisting. Think of the 50,000 times that Thomas Edison had to keep on trying until he got this one eureka moment. Yeah. Think of the many times you probably have to do recording so that you're perfect. So failure should be viewed as experiences. We learn from failure and challenge ourselves. And you have to be comfortable comfortable with the uncomfortable. It will take you a lot. Yeah, so dare to fail, dare to be different, quit holding out, quit holding back, quit running away from what you want. Set your goals and go for it. So my goal for this month is to empower the men in this room, in this live, yeah, on your health, physical health, mental health, and social health. Let's have these discussions. If you like this, invite a man, or maybe I have it in a group. Let's have this discussion. Send messages. Let me know what you'd want to be discussed. I wish you a good evening and a lovely Sunday morning. See you.